Hi guys, welcome to LDFS. I'm Dr. Lakshmy. Today we will be discussing something very interesting. This is one aspect which we have either totally neglected or we have usually gone overboard. So let's discuss about that one aspect today. But before we proceed further, kindly like, share, and subscribe to our channel. There are a lot of interesting stuff which are going to come in next few months. So follow us to get instant update of whatever we are uploading online. And sorry, my voice is not so clear. I have been suffering from throat pain, throat infection for past few weeks, so this voice is not so clear. So sorry for that. In today's topic, we'll be discussing about upgradation. Now, upgradation, it can be both clinical or personal. We'll be discussing about both today. And usually this aspect is something which we either totally neglect, we don't at all invest anything in it, or we invest too much in it and go overboard. Let's discuss about personal upgradation first. In personal upgradation, we often have to unlearn and then learn something new. For example, the root canal. Imagine if somebody is practicing for past 20 years. They must have gone through so many changes. First of all, earlier the root canal concept also wasn't accepted by many. Many people were not doing that treatment. Then learning that skill and then learning the rotary part of it. So it's total a new upgradation is coming. The whole in dentistry as such, the field is so huge and so fast it is developing. There are new products coming in market every now and then, and if we don't upgrade ourselves, we will lag behind, and somewhere down the road we will face the consequences if we don't upgrade ourselves. Now let's take an example. Imagine the same root canal example. Imagine if you have a 20-25-year-old practice. Those doctors may not have learned root canal in their college. After college, they must have been practicing extractions and all. Later on, this root canal came. If they didn't upgrade that, would they be able to survive in today's world? Because there are so many people whose bread and butter of the clinic is the root canal treatments. So imagine if they have not upgraded. That would have been a disaster to them, right? Similarly, for us, maybe it's implant, maybe it's veneers, maybe it's full mouth rehab. We don't know what future holds. In fact, there are so many things coming now: laser dentistry, laser root canal, so many things. We need to constantly upgrade ourselves so that we are ready for the market. That is something which is very important. So one of the important thing is upgrading the skills. It may be, if you are endodontist, maybe you can focus only on the root canal part or something else also. It's up to you, whatever you are interested in. But constant upgradation is important. Now, how much to upgrade ourselves? Usually, what are the reasons? Let's first discuss about that. Why we are hesitant to upgrade first, and second we'll discuss about how we go overboard about it. Okay. So why are we hesitant? Maybe one of the factor is the cost factor. We feel that all these courses are so costly that we have to spend so much, and whether after spending so much and investing so much in the clinic, is it wise to invest again in some courses and then learn something new? If we are getting good success rate from the treatments and the methods which we are using now, what is the harm in not upgrading right now? That may be one school of thought. Now I'll tell you some what my thought process is on this topic is that imagine if you are doing right now only rotary root canals, nothing else. You are not even doing a single sitting root canals. You are having patients who usually nowadays Google their treatments. In fact, they Google their symptoms first and then visit us, and after getting the consultation done, they'll Google the treatment. and then they'll come back to us saying like, there are this treatments which we have heard about. We have heard about painless dentistry. What is it? We have heard about single sitting RCTs. Why is that not possible in my case? I don't have time, etc. So they may come up with a lot of ideas, lot of things which are there in the market. So patients are constantly googling before even accepting the treatment which we are offering them. So we need to upgrade ourselves so that we are up to date, we know all these things, and we can reason with them why and why not we can do such treatments with them. So that is the one reason. Second reason is, yes, I know the money is a major part, that after investing so much money in your clinic and establishing it, we tend to feel that let the clinic earn by itself, there will be some patient flow and then we'll get money. And once that stage reaches, when we are getting enough money, the problem we'll face is we won't have time. Simply we won't have time, because we will be working so hard to make it work, and then we are so involved in the clinic and the patients and everything, we don't have time to do take 1 week leave, go somewhere and then do the course, etc., etc. So I'm just taking example, okay? So that may be one reason. But the problem of these whole thing is, if we don't upgrade, we are losing out on a lot of things which other clinics, your competitors, are offering and you are not offering. So at some point the patient will feel that this clinic is not upgraded up to the mark and the other clinics are. So why not let's try those things, maybe the single sitting or maybe something else, maybe the laser dentistry, some random thing. And second thing is the money part. We think about short term, we are not thinking about long term when we are thinking about investing money in learning these things. When we invest money in these things, we learn so many new skills that can be put to use and we can earn money from that. So this is sort of an investment. Treat it as investment, don't treat it as an expense. It is an investment similarly to the clinic which you have established. When you establish the clinic, you invest something, right? That's similarly, you have to invest on yourself, your upgradation, whichever field you are okay with. That field you have to constantly upgrade, and then later on, that will fetch you money in the future. But that will take time. I'm sure it won't be within 1 month or 1 week you'll get the result, but it will eventually show. You won't be outdated if after 10 years of practice, everybody is having some new skills and you are not having it. Then you'll feel that you have wasted those 10 years. I have gone through that same journey and I have done those mistakes. So I would really tell you, don't do that. Always keep on upgrading yourself. Keep on learning new things. That is something. And don't treat it as an expense. Treat it as an investment which you're doing on yourself. Now let's discuss about overboarding. Sometimes people spend way too much money in different courses. They are not focused. They feel that we have to do all the courses which are there available. They'll do X and they'll do Y. They'll concentrate on everything. They'll concentrate on aesthetic dentistry. They'll concentrate on TMJ pain. They'll concentrate on implant. Everything together. So when you do 100 courses, it will be difficult for you to implement those things in your clinic. Rather than that, focus on 1 or 2 courses and do the basic and the advanced courses in that, and then start applying those things in your clinic right now. There's no tomorrow. Whatever you are learning today, start applying it from today onwards, so that you will see the result, you will learn faster, you will know whether you are interested in doing those things or not, whether you are doing it correctly or not. And it's best when we apply, whenever we are learning something, at that time we are applying, we'll learn more. We'll learn much faster. There will be better questions, better doubt, which we can ask in the course and we can understand better, we can get help better. Rather than that, what people do is they'll just do the course, they'll complete the course and they don't implement it for next maybe 6 months or 1 year. Then it's totally waste of time, because whenever you again start about thinking of applying those things, you have to learn those things again. You won't remember. We will forget. We tend to forget. So whenever we are learning something new, always remember, apply that practical itself right now. No tomorrow, right now. So that is something which we should start doing it, so that we don't go overboard and we start applying those things right now. And whenever you are choosing some courses, always think, what is your ultimate goal? Where do you want to reach? So what all courses will help you reach that goal? Rather than that, doing all the courses which are available and then spending way too much money and not getting enough money in return from your clinic itself. That is not correct. So invest money and try to earn that money back from your clinic itself. So that is all about personal upgradation. Just a gist which I am giving you. Next comes clinic upgradation. Now, what clinic upgradation is? Clinic upgradation means it can be about how the data is entered, how you are you using any software, how are you interacting with your patients, are you using the right marketing tools. All these things we have to constantly upgrade ourselves to the newest thing which are available. It may be maybe imagine you are the Orkut. Do you remember the Orkut days? We had Orkut, we were so using it so frequently, like we are using WhatsApp or Facebook kind of thing. But right now, if you are using Orkut, whether it will help you fetch patients? No, right? Similarly, you have to upgrade with whatever is the market right now. If market needs you to constantly be online, you have to be online. If the market needs you to save data in some different form, you have to do that. I'll give you a simple example. Right now, the majority of the clinic doesn't have papers. They are having paperless system. They are having some software and they are updating everything there. It's easy because whenever you want to do some follow-up, you want to do some marketing method, something, you want to approach your earlier patients, it's easy to fetch. There's no one person required who will go through the entire the patient chart and then pick up that one paper and then give it to you that, okay, this was the patient, we did this is that treatment. Rather than that, it's just minutes away. You can just search in your software and you'll get all the data required and all the treatments done for that patient, everything in just a fraction of a second. That is important because that will save your time. Time is also important. And imagine if the patients are visiting. Patients are they understand these things. We feel that, okay, it's irrelevant, the patient won't understand, and how does it matter to the patient? But it matters. Imagine you are visiting some shop or rather a restaurant, and there you're done with your dinner, everything is done. Now the payment part comes. If they tell you that they accept only cash, that is a problem to us because they are sticking to the old kind of mentality. We don't have cash. We usually nowadays don't carry cash. And imagine the card system is not working maybe. So right now the Google Pay, Paytm, and so many different things are there. So many online transactions are there. If those are not available, would it create a good impression about that restaurant in your mind? Everything was good, food was good, everything was good. But the payment part had troubled you. You had to go to ATM to get cash and then come back and pay for your dinner. These are the simple things. I'm just telling you that sometimes these things are important. The demonetization which happened at that time, it helped us, a lot of clinic in fact, to go to the online transaction method, to shift to the Google Pay, Paytm, etc. Earlier, many clinics in fact had only cash system. They didn't even had a card system. This demonetization helped us to move towards the online payment thing. But that is important. Nowadays, nobody is doing cash transactions. Everybody, even we are doing Paytm or Google Pay, even if we visit a small shop. So these are small things, the payment part and all those things. Maybe the receipt, everybody wants it online. But these are important for improving the patient satisfaction. And when we improve the patient satisfaction, it helps us convert normal patients to the loyal patients. And that is what we want. We want more loyal patients. We want them to come back to us again and get the treatment done. So that these things help us achieve that. There are other things like the the X-ray machines. X-ray machines nowadays, everybody is going towards a digital X-ray machine, RVG, and so many clinics are offering free digital X-ray, free digital X-ray. So patients feel that the digital X-ray is something better than the normal X-rays. They feel that they will be able to diagnose better, they will be able to do the treatment better. So it's a myth, but yes, the patient think like that. Don't think from a doctor's perspective. Ask some other your friends who are not at all from the medical field. Ask them about that. What do they feel if there are two clinics? One clinic is offering digital X-rays, another clinic is having the old method. So where do they think that the treatment will be better? It's just they feel that the digital X-ray means there's something new and there's something interesting, and the treatment and the equipments used and everything used will be modern. So this creates a false image, but yes, it's important. So maybe you can go towards the digital X-ray thing. That is something upgradation which you can do in your clinic. And always remember, don't go overboard. In this also, the clinic upgradation also, it is important. We can buy n number of things and make our clinic world class, but the money which you are spending and the money which you are getting back is something which is important. So invest in those things first which are important to do your treatment, important to, or they are directly impacting the patient satisfaction. Those things, invest in those things first, and later on you can go on investing in other things. So that is something, a personal tip from my side. So this is overall a gist about upgradation. So don't forget, whatever you are learning, even if you are just pass, continue your learning process. Don't leave it. Be curious about new things. In fact, these FAMDent and Expodent, all those things, visit those events, because that helps us learn something new. That helps us understand what is there in the market, what is new in the market. Every time whenever I visit, I find something new which I've never heard about. So always go there, attend those lectures, visit those stalls, understand what is there new in the market and where you can upgrade. Don't upgrade everywhere, but upgrade in few things every time you visit these kind of events. I hope today's videos was useful and you have loved it. Kindly let me know in the comment section what do you all think about it, and how often you have upgraded your clinic or yourself. Send us a hi on this number. We'll add you to the WhatsApp special broadcast list, and you'll be notified for whatever things we are releasing online. Thank you so much, guys. Don't forget to like, share and subscribe, and click the bell icon. Thank you so much. Bye.